Hi, this is Access SF Television. You're watching SF Live. I'm your host, Rebecca Arnold. Today we've got a guest. His name is Andrew Reynolds. He is the STD HIV coordinator at the San Francisco City Clinic. It's an old institution that's been around a long time, and they do so much good work. This show is going to cover a lot about STDs and HIV infection, how to handle it, how to notify people afterward, and it's also going to talk about the PEP, which is post-exposure prophylaxis. There's going to be a lot of, candid talk about it all, so just know, the viewers, that we're going to be talking about this. And I'd like to welcome Andrew to the show.
Thanks for having me.
So give us a little brief synopsis of what the San Francisco City Clinic is, how long they've been around, what they do.
Okay, well, I don't know exactly how long it's been around, but I know it's been around for, 80 some odd years, give or take, in some capacity. We're primarily an STD clinic for the city of San Francisco, although we've been known, we help people from throughout the Bay Area. It's a very sort of, mobile site. Busy clinic. We're open Monday through Friday. One of the only fully functioning 40-hour per week clinics in the Bay Area, let alone San Francisco. So we can be a happening place at a lot of times.
And do you do all kinds of health services, or just STD, HIV?
Just STD and HIV. We have a small primary care clinic for people living with HIV. We provide family planning services, but we're mainly for the promotion of sexual health in San Francisco.
And where is it located? What's the address?
356 7th Street, so it's south of Market. We're located between Folsom and Harrison.
Okay. Got it. And the website, if you'd like to take a look for more information, I'll just give that out straight away. It's sfcityclinic.org. That's sfcityclinic.org. So let's talk about routine HIV testing with RNA. Okay. Explain that to us.
All right. Yeah, definitely. So it's really exciting. It's very kind of cutting edge HIV testing, and we're one of the few clinics in the country that does it this way. And the trick with HIV transmission, obviously, is knowing your status. And as simple as that sounds, it can actually be fairly complicated. I mean, with HIV antibodies, there could be a period of time where I'm infected with HIV, but my body has yet to make antibodies in response to that infection. And so we offer an array of testing services.
Because that can be a 6-month gap, is that right? It
can be up to 6 months. For most people, it's between week 2 and week 12.
So it was always kind of harrowing if you think you may have been exposed recently, but you've got 6 months to suffer through worrying about it and potentially exposing others to it. And so now we've got some new ways to test, yeah?
Right, yeah. So what we'll do is everybody who gets an HIV test at City Clinic gets what's called an HIV RNA test, also known as a viral load test. And what that test does is, it's a blood draw, so we're drawing blood, and then it looks directly for the virus. And the benefit of that test is it reduces that waiting period. So if I am concerned about something that happened a month ago, today's antibody test isn't going to give me the complete picture. If I'm negative, that's great. I got to wait another 2 months and then possibly another 3 months after that. But with the RNA test, most people will develop what's called a detectable viral load, enough virus to count after about 10 to 12 days. So that event that I was concerned about a month ago, today's RNA test is negative. A lot of stress has just been washed off of me.
And it's finite. You know for sure you don't have it.
Yeah, I mean, officially you still go by the antibody guidelines.
Okay.
That's sort of the CDC standard. But sort of scientifically, if I was infected with HIV, I would have a very high viral load in that early stage of infection, what we call the acute stage of HIV.
And that tends to show itself within a month?
As quickly as 10 to 12 days.
10 to 12 days,
yeah.
Sorry. So 10 to 12 days. So you can find out the answer in 10 to 12 days pretty self-assuredly. And how long has this test been around?
That I don't know. I believe
we've been doing it?
I think we've been doing it at City Clinic since 2002, 2003. It's the same test that they provide people who are living with HIV to sort of monitor their virus. We're just using it from a sort of prevention detection methodology.
And do many places offer this kind of testing that do HIV testing, or is this still pretty uncommon?
It's fairly uncommon. I know the city of Seattle does it I believe a couple of clinics in New York, Washington, D.C. In San Francisco, we do it for everybody. If you get an HIV test at City Clinic, you're getting an RNA test. There are a couple of other clinics that do it, Magnet and AIDS Health Project. They do it on a more risk-based measure, but they do offer it.
And how much does it cost?
I don't know what the cost is. For the person coming to City Clinic, it's free. We don't charge anybody for services.
Do you have to qualify, though, and show that you're low income or any of that, or?
No, we'll see anybody.
That's super.
Yeah, and then, we don't necessarily test everybody who rolls through City Clinic, because not everybody needs an HIV test. But after you've met with a clinician and they've done the sort of STD history and risk assessment, if it's determined that you need an HIV test, we'll give it to you, and you'll get an antibody test, and then you'll get a viral load test.
And it's all confidential, which we're going to get into a little bit later, but
Yeah.
that's fantastic.
Yeah, everything's confidential. Like if you have health insurance and you come to see us, your health insurance doesn't know about it.
Yay. Health insurance companies, whoa. And so you also test for gonorrhea and chlamydia and the, let's see, all the different areas of the body you could have it.
Yep,
Let's
yep.
just say it, leave it at that.
If you use it, we test it.
That's great. And we were just talking before the show that those are two of the top transmitted STDs in the country.
Yeah. Yeah, they're very common. Chlamydia is probably number one. Gonorrhea ranks, a close second behind it. And that's the same here in San Francisco. I mean, those are the STDs we see more often than not. They're often asymptomatic, so you could have it and you don't know it.
That's what's really frightening. And from a female standpoint, I can say that, chlamydia sounds kind of low-key. You realize finally that you have it, you kind of treat it, all's well. But if you have it for an extended period of time, you could actually be sterile. You could
Yeah.
not be able to have children ever again. So it's actually very serious, and you may not have any symptoms. So if you have any idea at all that you may have been exposed, and if you're a man and you find out you have it, it's imperative to tell any women that you've been with.
Yes.
Because of that reason. It's actually, to me, sort of one of the silent, scary ones that, may not have a terrible social reputation, but can be devastating to the life of a woman who wants
Yeah.
to have children.
Yeah, I mean, pelvic inflammatory disease can lead to infertility, long-term chronic pain, a host of medical issues. And it's one of those things that is remarkably easy to treat.
What's pelvic inflammatory disease?
It's like an infection that can happen where it can kind of scar the woman's fallopian tubes.
Is that
essentially.
from chlamydia, or is
It
that
could
a
be
separate
it could be
thing?
from chlamydia or other things, but chlamydia causes it
Okay.
often. Real easy to treat.
Mm-hmm.
And again, at City Clinic, we'll test for it, and if you're positive, we'll treat you, and then we also will give you partner packs so that you can hand those partner packs out to people who you've had sex with, so that they can take the pills without having to even come into the clinic.
Oh, so packs as in of medicine.
Yeah, yeah,
And it's all free?
yep,
That's amazing.
yeah. It's I think it's one of the best things that we do. I mean, because and we often say, we're taking care of the people who are sitting in our waiting room, but we're also taking care of their partners.
That's
as-
really
as
how
well.
it should work.
Right.
I mean, that sounds effective.
Yeah.
Great. And so, let's see. What's the difference? Oh, well, we've talked about that. And then let me go to the next point we want to talk about, and that is the PEP, which is the acronym we're going to probably be using because it's such a long title. Post-exposure prophylaxis. Tell us about that.
Okay. So it's post-exposure prophylaxis, and technically it's non-occupational post-exposure prophylaxis. So what it is it's...
So if you're not a doctor or a nurse or
Exactly.
somebody that works in the medicine, that's occupational, and so
Yeah.
recreational.
It's for folks who are exposed to HIV through sex, sharing syringes, things like that. It's the same course of medicines that they gave clinicians back in the mid-'90s who were getting needle sticks. And
They started with them in the beginning, yeah.
Yeah. So I'm drawing blood from an HIV positive person. I get a needle stick. HIV infected blood gets inside of me. The highest risk form of HIV transmission.
And they're in a healthcare setting, so you know it
Yeah.
happened for sure, and they've got help right there, and
Yes.
so they came up with this.
Yeah. New infections were reduced by 81%. So not 100%, but 81% is pretty
That's
significant.
really high. So you actually got HIV positive blood in you, and you were given a pill?
A course of pills,
A course
28 days of pills.
Okay, for 28 days. That essentially eradicated it?
Well, I mean, it's tricky because, infection doesn't mean or exposure doesn't mean automatic infection. So I might have tested negative whether or not I took PEP. But again, when you look at new infections reduced by 81% in the healthcare setting, that speaks to some medical efficacy of these pills. So let's make it available to the community at large. And the San Francisco Department of Public Health, to the best of my knowledge, was one of the pioneers on this, where they kind of ran a study. City Clinic was one of the sites where it ran out of. And we made it available to non-occupational folks like you and me. And it was, again, remarkably effective. The positivity rate was maybe 1%. So 99% of people who completed PEP and followed up with their testing stayed HIV negative.